The primary objective of occlusal adjustment is accomplished by selective grinding of tooth surfaces that cause stressful occlusal contacts and interfere with jaw function. This series of videos will introduce basic terminology related to occlusal adjustment, types of interferences, and how these adjustments are performed. The process of equilibration will be carried out in a sequential manner. Centric relation is a maxillomandibular relationship. The position has been difficult to define anatomically but is determined clinically by assessing when the jaw can hinge on a fixed terminal axis, up to 25 mm. It is independent of tooth contact. It is considered a reliable and reproducible reference point. A position at which the mandible behaves as a pure hinge. Maximal intercuspal position or MIP. The complete intercuspation of opposing teeth independent of condylar position. Sometimes referred to as the best fit of the teeth. In general, MIP is located anterior to CR. The mandible no longer functions as a hinge, but assumes an anterior lateral component of motion as the teeth interdigitate. Premature contact is an occlusal contact occurring before stable jaw-to-jaw relationship is attained. Also known as a deflective occlusal contact. It is any contact that displaces a tooth, diverts the mandible from its intended movement, or displaces a removable denture from its basal seat. Supporting cusps or holding cusps are the lingual cusps of maxillary posterior teeth and the buccal cusps of the mandibular posterior teeth. Also included are the incisal edges of the mandibular anterior teeth. Centric stops or centric holding contacts. The opposing cusp foci contacts that maintain the occlusal vertical dimension between the opposing arches. One of the basic principles of occlusal adjustment is to establish even distribution of centric stops over the teeth, and to shape and locate the stops, so that the forces are directed as nearly parallel as possible to the long axes of both upper and lower teeth. To prevent tooth movement, the contact areas for the supporting or holding cusps should never be left on unbalanced slanting inclines. The contact areas have to be either on a flat surface perpendicular to the long axis of the teeth or on opposing balancing inclines. Working side movement. This is also known as lateral protrusion. Working side occlusion refers to the occlusal relationship of the teeth on the side of the rotating condyle. Movement is away from the tongue. The non-working side movement is also called mediatrusion. It is movement of the mandible toward the tongue and on the side of the orbiting condyle. Non-working side contacts are often the cause of traumatic occlusion, and should be removed whenever possible. Protrusive excursions. The path of the lower posterior teeth, as the mandible leaves centric and moves protrusively. Only the anterior teeth should touch in protrusive excursions. Variation in distribution of lateral stresses. There are several variations of lateral stress distribution. Group function. The distribution of lateral forces to a group of teeth on the working side. Distribution of lateral forces to selected teeth, while others contact only in centric. Permits exclusion of weak hypermobile teeth from lateral stresses. Cuspid protected occlusion. Lateral stresses are carried primarily by the cuspids. Mutually protected occlusion. In this philosophy of occlusion, the posterior teeth protect the anterior teeth enclosure. The anterior teeth act to protect the posterior teeth in eccentric motion. In natural occlusion, there should be no contact of posterior teeth, as the mandible protrudes. Occlusal adjustment refers to the selective grinding of tooth surfaces to eliminate stressful occlusal contacts, which interfere with normal jaw function. The process is subtractive and irreversible. A number of situations exist where occlusal adjustment is contraindicated. In the next video we will discuss the types of interferences and a few basic guidelines for equilibration. It should be noted however that due to the individual variations in occlusal contacts, it is impossible to list a set of equilibration rules that would be applied equally to all patients.